on. Can you hear me? Yeah. All right. Thank you all for being here today. And good afternoon. And I'd like to welcome you to the 2023 Live Well San Diego 22nd Annual Public Health Champion Awards ceremony. Now, we would like to thank you for taking the time to be here today as we recognize the achievements of local individuals and organizations in public health, partners who share in our dedication to the mission of public health. Now, Public Health Services would like to, before we get started, would like to begin by acknowledging the indigenous people of all of the lands that we are on today. We acknowledge the importance of the lands which we each call home. We respectfully acknowledge that we are on the traditional territory of the Akumie tribal nation. We offer our gratitude to the First Nations for their care for and teachings about our earth and our relations. May we honor these teachings. Now, many of you may not know, but my name is Dr. Wilma Wooten. I'm the Public Health Officer for Public Health Services in the County of San Diego Health and Human Services Agency, and I will be your moderator for today's event. But first, before we get started, I'd like to just go over a couple of housekeeping items. I'd like to invite everyone to please silence their cell phones. Bathrooms are located on either side of the hallway near the stairwells, and no food or drink is allowed in the board chamber. We will have a reception at the end of the event. The next item is very important. For the awardees, once your name is called, you will be escorted by our county staff to the front area here and assembling yourselves for a photo op once the bios have been read. And here we will receive your award, a Public Health Champion recipient, and a certificate, and a Public Health Champion pin. Pictures will be taken while your biography is presented, and you are welcome to invite your guests or family members or anyone that you feel you want to be with you as the photos are taken. After the chairwoman's remarks, we ask that all awardees come to the front to take a group photo. Unfortunately, she's pressed on time, as many of our other awardees are today, and so we wanted to honor her presence with all of the recipients before she leaves. So, as you all know by now, this signature event occurs during and is in celebration of the American Public Health Association National Public Health Week, held during the first week of April every year. Public Health Services is very pleased to celebrate local efforts towards this year's theme, centering and celebrating cultures in health. This theme focuses on celebrating the unique and joyful ways different cultures focus on health. It also looks to how we can learn from each other with humility and openness. National Public Health Week for 2023 promotes how we can center and celebrate cultures in health by showcasing 7 themes. And these sub-themes will be highlighted every day during this week. I would like to share each of these themes with you, as well as some examples of how you can promote these themes. Now, the first sub-theme is community. And as you all may or may not know, community, and specifically community engagement, is at the center of the county's strategic plan. Community is where we are. It is our connections with others who share similar interests, attitudes, and goals. Becoming more engaged or re-engaging with the community is important to make an impact on public health. For example, join a community garden, donate healthy and culturally appropriate canned food options to food pantries, or volunteer at local food distributions. The second sub-theme is violence prevention. Culturally specific interventions are critical to effective violence prevention and reduction. Learn about community-based strategies for creating the kinds of safe, stable, and nurturing environments that help prevent child abuse and neglect. Advocate for community-driven solutions that identify the root of violence. The third sub-theme, reproductive and sexual health. When people achieve quality reproductive and sexual health care, education, and access, they can fulfill a happier and healthier life. The lack of inclusive and accessible reproductive and sexual health care and education negatively affects everyone, but marginalized communities carry a greater burden of harm. Support Black, Indigenous, and other people of color reproductive justice through actions like voting in federal, state, and local elections for candidates and policies that center inclusive and accessible sexual and reproductive health. The fourth sub-theme is mental health, and this has been at the forefront of our communities during the COVID-19 pandemic. Mental health is important at every stage of life. It continuously affects how people think, feel, and act. It also plays an important role in physical and social well-being. To make an impact on the community's mental health and well-being, volunteer for a local mental health organization and attend events such as walks and fundraisers that support the mental health movement. The fifth sub-theme is rural health. 14% of Americans nationwide live in rural areas. Rural Americans have higher rates of cigarette smoking, high blood pressure, and diabetes. Improve mental and physical health and community involvement by working with federally qualified health centers that deliver care to all patients with or without insurance. The sixth sub-theme is accessibility. To move forward through health equity, it is critical to recognize that people with disabilities are facing health disparities. Improving access to nutritious foods, particularly in areas with limited access to fresh produce, has been linked to improving overall health and eating habits. Doctors' offices can provide health information and resources in multiple languages for people whose primary language is not English. The seventh and last sub-theme is food and nutrition. Food and nutrition are the core of many public health concerns, from chronic disease to climate change. Accessibility and affordability of nutritious food can determine a lifetime of health outcomes. To ensure everyone has the food they need to thrive, systemic changes are essential. Contribute to the local community by volunteering with the food bank in your area. Needless to say, there is a role for everyone in making our region healthier and safer. Everyone can have a hand in improving our community towards that vision of centering and celebrating cultures in health. These daily themes are components of the 10 essential public health services of public health. As an accredited health department since May of 2016, the Department of Public Health Services values the relationship with many partners to promote health and wellness, prevent disease and disability, and protect the public's health. It goes without saying that the sub-themes are embodied by Live Well San Diego, a long-term vision to build a healthy, safe, and thriving region. I would like to personally thank everyone here today, and especially all of the awardees, for your commitment and leadership in forging and building a healthier San Diego County, which helps to build a healthier America and a healthier world. And now I will introduce our County Health and Human Services Agency Director, Nick Mascione.
Thank you, Dr. Wooten. Before I jump in, we're extraordinarily fortunate in having a public health leader who's been here all those 22 years of the annual. That's Dr. Wilma Wooten. Give her a round of applause. It is absolutely great to be here with you to honor the Live Well, San Diego Live Well leaders, public health champions, because what you're going to hear repeatedly is that we can't do it alone. Government can't do it alone. Community can't do it alone. The business community can't do it alone. We need each other. And what we have shown in this region is pretty extraordinary. It's not just bringing in our praise of you, our community leaders, and what you do and how you go above and beyond each and every day. It's how we brought and came together and continue to come together in a way no other community has quite yet been able to replicate. People talk about what makes San Diego special, and they often think about the weather, minus maybe today, but it is the weather, right? And I always said when I came here 26 years ago, what struck me was not La Jolla's weather, it was the people. It was the people. And it's true to this day. It is the people that make this place extraordinary. And so this ceremony is really celebrating not only 17 extraordinary people and organizations, it's really celebrating what we stand for in this region, of making a difference, tackling the hard stuff, doing the big things, and improving the lives of folks. And so I had a bunch of slides that my team's going to get upset about that I was going to go into, but I'm going to forego, because really the message I want to carry is this. When we set on course to do something unthinkable in this region, in the nation, about how do we help people live well, we said we're going to measure that by a number of things. Yes, indeed, poverty is at the center of it, and access to care and knowledge. But we said ultimately we're going to hold ourselves to life expectancy and quality of life. I want to say it again, life expectancy and quality of life. Go talk to most jurisdictions. They're not talking about holding themselves accountable to life expectancy and quality of life. We are, and we have. And we have made sizable improvements. We have a long way still to go. But where the nation's going in the wrong trajectory, in the reduction of life expectancy, that is not the case here in San Diego. Why is that? I think it's that we have the belief in our institutions, our leaders, each other, that we're working hard to making sure not only those of us in this room and those that have access, but those that do not have access are being helped. So that a homeless individual that's dying 25 years earlier than any of us in this room is not, and stopping that. And so this is the difficult, challenging things we do. And often there's no time to just take a respite to say, thank you, because we're always rushing to save and improve lives. And that's why this ceremony is so important, because it is about collaboration, but it's also about the celebration of the accomplishments we have made and continue to make. The one slide I just want to show is our partner slide, if I may. This is our framework here. When we started this journey about living well, which we knew wasn't just about building better health. This is the Public Health Champions Award, Live Well San Diego Leader Awards. It's where health meets safety. In the presence of violence, you can't achieve health. And we also know we have to be kind to our natural environment, our built environment, housing, literacy. But no one, and I mean no one, because we talk about this, and you'll hear a moment from our chairwoman at the National Association of Counties, also with the U.S. Conference of Mayors. Yes, the city of San Diego is a Live Well partner for the record, and Mayor Gloria was there to receive that proclamation, became a Live Well partner. I just want to go on record on that. And he has been a believer, and you'll hear more about him in a moment. But no jurisdiction in the nation has really been able to bring and sustain. And when you look at the extraordinary number of partners across the different sectors, it's not just the health sector. It's pet supply stores, because pets matter too. It is schools, it's cities, it's institutions, it's businesses. Yeah, WD-40, Lube Well to Live Well, I thought was their logo. I mean, you have all kinds of entities, right? Right? We have all type of partners with over 95% sustainment. A few that we've lost along the way. This is the journey, and we're still growing. And all of this for the public good. Not a single is about a contract. It is about a handshake of working together, leveraging our resources, growing our innovation together to improving life expectancy and quality of life. So we are extraordinarily fortunate in this region having you celebrating, and we're going to be talking more about you, but understand we need each and every one of you and many more that we still have to enlist in our journey of having every San Diegan live well. And on that note of how do you achieve equity in action, you need extraordinary leaders. And we are very fortunate in having our leader here, our chairwoman for the County Board of Supervisors, representing not only South Bay, but all of the entire county, Nora Vargas.
How are you, everyone? Buenas tardes. I'm so happy that all of you are here today and that we get to celebrate. I think we need to give Nick a big round of applause because him and his team are always ready to get to work and roll up their sleeves and do the hard work for our communities, and always doing it with corazón, which I think is very unique to the work that we do here in San Diego. And thank you, Dr. Wooten, for everything that you do and for your leadership as well. I still have to say that it's so wonderful to be in person anywhere, right? Because I'm really not trying to do any more Zoom. But I really wanted to stop by and say congratulations to all of you. And I love the fact that it says centering and celebrating cultures and health, right? And I think that's a really, really important piece of this work and the work that we're doing as we're moving forward. I think most of you know I come from a background in public health care. And I remember fighting really hard for my organization to become a Live Well partner. And we were so, so happy when we did, because we knew what it meant for the thousands and thousands of people in San Diego County who just needed to be able to call 211 and be able to have access to those resources, and what it meant to be at the table, to have the discussion about how we were going to make sure that our communities had access to healthcare and from various lenses. And so we've been, I'm sharing this story because I think it's important. I remember when I was running for office, I said, healthcare is my top priority, right? Because I come from healthcare, and I knew the health inequities that our communities had been facing for so many years. And I had a reporter say to me, well, that's not an important issue. Nobody cares about that. And then we were hit by COVID. And I think what COVID demonstrated to us is that the best thing that we could do together was to find ways to break down barriers for our communities to be able to have the access that they needed. We didn't do everything perfectly, but what we did is we came together. And as a county, we didn't do it alone. We did it in partnership with all of you. We did it in partnership with the media. We did it in partnership with local government. We did it in partnership with school boards. We did it in partnership with community. We listened to community, but we also did it based on science. And we made sure that we did everything in our power to make sure that everyone had access and that we were looking at things from an equity lens. And to me, that was really important. And I want to make sure that we continue to take those lessons of what we learned from that experience to remember that we have the power to break down those barriers to make sure that people have access to healthcare, that those barriers of inequity are broken down continuously, and that there is no, we can't do that, but let's figure it out how to do it together. And I think that's the lesson that we learned and that we must continue to move forward with. And so as the chairwoman of the Board of Supervisors and a longtime public health care advocate for me, I love the Live Well work that we do, because what it really is all about is meeting people where they're at. And I think that's the beauty of the work that the county has been doing. And I want to make sure that everyone knows that the county team has been doing this work for many, many years, but it took the leadership of the Board of Supervisors to be your true partners in this process, to say, we got you and we're going to do this together to make sure that people get the resources that they need. And then we start thinking outside the box about how we're going to get those resources to them. So I am thrilled about what is to come. There's a lot of funding because of ARPA funding. There's a lot of funding that we have made it a priority to make sure that health equity is what we're going to be doing as we're moving forward. we understand firsthand that we are going to do this work from a holistic perspective, that we're going to put partisan issues aside and really think about how we work for our communities to do the best that we can so that they can have access to housing security, food, sovereignty. We're going to work on environmental issues and the things that really matter to all San Diegans. And so we're going to continue to do that work from mental health care to making sure that our Office of Sustainability and Environmental Justice continues to advocate for clean air and water and to improve our frontline communities. We are on it, and we're going to continue to move this forward because for us, these are all the issues that are our priority. And last year, we were able to declare homelessness a public health care crisis. And we did that knowing that it would help us ensure that there were resources available. But again, we know we can't do that alone. The regional task force is one of our huge partners, as well as the mayor, who has been an absolute partner with all of us. And many of you here have been exceptional in making sure that we are doing this work and doing it together. And so I am excited about the continued work that we will do together that not only our communities deserve, but I think we have some of the most exceptional team members in the County of San Diego that are ready to continue to do this work and do it in partnership with all of you. So I am excited, and I'm just going to say that it's been a little bit tough this last week. But I want you to know that, I got you, we got you, we're going to get this done, and we're going to continue to do the great work that our communities and our residents deserve because this county is strong, we have a strong team, and we're going to get it done for everyone because that's what our communities deserve. So, muchísimas gracias por la oportunidad de estar con ustedes. Congratulations to everyone here. I love you all, by the way. You're all amazing. And I can't say I have favorites because then I'll get in trouble, sir. But I feel very fortunate to be in this role and to be able to work with all of you and to continue this work as we move forward because there's a lot of great things coming and we're going to do this together. So muchísimas gracias. I hope you have a wonderful day, and I have to excuse myself, but thank you for everything that you do. Excuse me. Okay. Who am I taking a picture with? Okay, do you want to do it? I'm sorry.
I would like to ask all of the recipients, you know who you are, to come down so that we can have a photo op with our chair of the Board of Supervisors. Thank you.
This is a big group.
All right, everybody, come on. Oh, I love this. Look at all these great people.
I go way in the back.
Let the Bayonne guy come in.
Back up a little bit.
Cheese, 1, 2, 3.
Yes, of course. Is that better? Or just be family?
Yeah.
Okay, 1, 2, 3. One more. 1, 2. Thank you.
Thank you, everyone. Thank you. You're welcome.
Adios, amor.
I owe you a visit. Oh, thank you. I was freezing this morning.
Excuse me.
Things are good?
So thank you all for your flexibility in today's program. And we also thank Chairwoman Vargas for being with us here today and sharing her heartfelt message. I would like to take now that we've had the photo, we will now go into the official presentation for our recipient. So I would like at this time to explain the Public Health Champion Awards. As you see there on the slide, these awards include today the Director's Award, and they will go in this order. There are 6 Director's Awards. There are 4 Public Health Services Awards, 1 theme, 2 individuals, 1 organization, and the Aging and Independence Services and Regional Awards. All awards presented here today honor an individual or an organization in San Diego County for outstanding contributions in the prevention of disease or injury and the promotion of public health. Now, the Director's Award honors individuals or organizations for their outstanding contributions to public health by collaborating with the Health and Human Services Agency through a common agenda, shared performance outcomes, mutual mission and goals, and with open and transparent communications. And these are all components of the collective impact. The Theme Award honors an individual or organization that has demonstrated outstanding contributions in the areas related to the theme of the annual National Public Health Week. The 2023 award winner should exemplify achievements in public health that have promoted a healthy nation and created a ripple effect throughout San Diego County communities in centering and celebrating cultures and health. The Individual Award honors an individual who has made outstanding contributions by taking into action health at the center while promoting a healthy nation in San Diego County. As well, the Organization Award honors a community organization that has made similar significant contributions in San Diego County communities. This year, we have 2 recipients, as I stated earlier, for the individual category, and 1 recipient for the organizational category. Next, nominations from Aging and Independent Services and our 6 regional awards are presented by the Director of the HHSA AIS Department, Kim Gallo, and the Director of the Office of Equitable Communities overseeing the 6 HHSA regions, and Jennifer Bradford-Coons will have that honor today. These awards also acknowledge individuals and organizations that have made outstanding contributions to the prevention of disease, injury, and/or the promotion of health in their targeted areas. They are restricted to individuals or organizations that have a working relationship with AIS or our 6 HHSA regions. To further acknowledge the recipients and their contributions, the name of this year's awardees will be permanently displayed on the Public Health Champion plaque that you see here on this slide, along with all awardees who have received this recognition in the past. You'll soon hear about these deserving awardees, how they protect and promote the health of our community and a nation as a whole. So now let's begin our award ceremony, starting with the Director's Award. Please welcome back to the podium Agency Director Nick Machion.
Thank you, Dr. Wooten. As Dr. Wooten mentioned, there's 6 awardees, and it's very important for me to say this, not in rank priority, okay? All 6 are equally important, very important. But I'm going to start with our first one, happens to not be here. traveling for good reason. And this goes to our California State Senate President Pro Tem, Tony Atkins. Yeah. Let me share. Tony Atkins, as we all know, is a trailblazer in many, many ways. Born and raised in rural southwestern Virginia, which she's quite proud of. She has lived in San Diego since 1985, where she committed herself to providing access to health care for women, becoming the director of clinic services at Women Care Health Center at the age of 27. And ever since, she has paved the way for women and the LGBTQ community and been a champion for affordable housing, our homeless, healthcare, veterans, and the environment. If you've been here long enough as a San Diegan, you know of Senator Tony Atkins. She has served in elective office since 2000, first as the San Diego City Council member, then interim mayor, and then state assemblywoman. By 2014, she was elected as Speaker of the Assembly as the first San Diegan and first lesbian to hold the position. She has proudly represented us in the state Senate since 2016, and after just 1 year, was selected as the Senate President Pro Tem. Get this, making her the first person in 150 years to lead both houses of the state legislature. That requires applause in and of itself. That's pretty historic. Yeah, she has represented us fiercely and effectively. Senator Atkins has championed landmark legislation like creating the state's earned income tax credit and establishing permanent sources of funding for affordable housing at the state level. She has led the charge to expand HIV/AIDS treatment and prevention services and secure funding for housing homeless LGBTQ+ youth. She has spearheaded countless pieces of legislation on homelessness and housing. Her accomplishments have, without a doubt, left a permanent mark, permanent healthy mark in our region. So huge congratulations to Senator Atkins. Let's give her a round of applause. To accept her award on her behalf is her district director, Pam Ilson, who's a leader in her own right and has been a great, great partner to work with. Thank you for being here, Pam. And we have your award right here. Dr. Wooten, are you going to come up? Our next Live Well San Diego leader and public health champion awardee is City of San Diego Mayor Todd Gloria, who is another trailblazer in our city and state. Mayor Gloria is a dear friend, and you'll see why in a moment. But first, let me share a little bit about our mayor here in the city of San Diego. He is a third-generation San Diegan who has spent his entire professional life in service to the public. He began his career proudly. You ready for this? It's an important trivia. He served his career proudly at the County of San Diego's Health and Human Service Agency, working in eligibility. He's one of us. He's one of us. We don't hold it against you that, leaving, but anything like that. But he went on to an incredible career, far more reaching in service to San Diegans. If you ever get the chance to hear about his personal story, about his father, his mother, his upbringing, it's extraordinary. My wife and I always love hearing that story. So if you get the privilege, please pay attention to it. It's pretty powerful. Todd went on to serve as the district director to U.S. Congresswoman the mighty Susan Davis. In 2008, Mayor Gloria was elected to the San Diego City Council, serving the 3rd District. Then 4 years later was elected by his peers as City Council President. Shortly after, he became interim mayor at an interim time and really served as the stabilizer for our city at a critical time, I will say. Mayor Gloria was elected then to the California State Assembly to represent the 78th Assembly District in 2016. He immediately, like Senator Atkins, he immediately rose to a leadership position in the Assembly, serving as the first Assistant Majority Whip and eventually the Majority Whip. As the 37th Mayor of San Diego, Mayor Gloria is committed to making San Diego a city of opportunity that invests not only in every neighborhood, but for every San Diegan. His passion is contagious, and you'll hear from him in a moment. He is guided by the idea that if you care about something, then you should leave it better than you found it. In every position he has held, that has been quite obvious. I've had the privilege of serving with Mayor Gloria as the Vice Chair of the Continuum of Care, the precursor to the Regional Task Force for the Homeless. And it was then that I witnessed firsthand his commitment, his courage, and his passion in addressing homelessness, and his care for our most vulnerable in our region. We've been able to stand side by side in recent years, opening a record number of new affordable housing units, homeless shelters, behavioral health treatment beds, and it goes on and on and on. His support during the peak of the COVID-19 pandemic also was paramount of importance. I would say it was invaluable. We had a true partner. We have the nation's best mayor right here. Congratulations to Mayor Tagle. Mayor.
Well, thank you, Nick. I appreciate those comments, and I heard you say that this is not in ranked order, but I will just let you know I'm always happy to follow Tony Atkins. In fact, I've made a career of it, and it's worked out pretty good for me. And I thank you, Nick and Wilma and the entire team at HHSA. As Nick mentioned, I did get my career start at Health and Human Services Agency. More than a few times I wondered, why the heck did I ever leave? It's a good job. And I would tell you, you probably have some vacancies. You should come work for the county. I can endorse that. I enjoyed my time at the county. And I thank you for this honor. It truly means a lot to me, even if you are showing off my really bad tan lines in this photo. It was all for public health. Proof that your mayor is not going to the beach. I'm doing the job, right? And get your flu shot. I would just say I will take this award in the spirit which I think it's given, which is around a city-county collaboration, that when we work together, the public's well-being, our quality of life is improved. When I decided to come back to San Diego to become, hopefully, the mayor, this was very important to us to accomplish, not just in the context of the pandemic, but in the ongoing concern of challenges that we face. And I want to just put two out there to use this opportunity. One is that we have to do more on homelessness. We are doing a tremendous amount on this particular issue. We've done more than anyone's ever done before, and that's because of the city-county collaboration, but we must do tremendous amount more. Obviously, the current circumstances are absolutely unacceptable, and when we work together, we can build more beds, more housing that has the supportive services that keep people housed. And I'm just grateful, again, for the city-county collaboration that has literally in 2 years' time provided about 700 additional shelter beds, and we have many more in the pipeline. So this collaboration is important. Another area of concern I want to draw attention to is the fentanyl crisis. This is supercharging our homelessness crisis, but is killing far too many of our fellow San Diegans. And as someone that is deeply committed to the Live Well message and making sure that my agency is doing everything I can't see this unfolding crisis happen without getting in this game. And last week we lost a couple of bills in the legislature that I think would have been meaningful to trying to drive change on this particular issue. But I won't give up because too many people are dying, too many people are getting sick, and the circumstances are unacceptable and unsustainable. I appreciate the partnership I have with our district attorney, working on pieces of legislation and other ways that we can work collaboratively. And we'll continue to do that work because it's critical for public health. So I'll simply conclude by saying I got my start at the county. It's doing pretty good, I think, all things considered. It could happen to you, and I want to encourage all the public servants who are here. Thank you for being in this game. Thank you for maintaining the notion that the noblest motive is the public good. That's the county's motto. I believe it deeply. I've made a career of it, and I want to thank the fellow honorees who are here today, whether it was chairing Tamara's board or chairing Kara's board. I've had the opportunity to work with many of the organizations being honored today, and I think this is a part of why we're such a strong community, why we are the envy of the rest of the nation. As the world turns their eyes to San Diego today, go Aztecs, that they don't just see an incredible basketball team, not just an incredible basketball team, but an incredible region that is committed to a high quality of life. All of us are a part of that mission, and I thank you for what you do, and I will commit to you to continue doing everything I can on this issue of public health, but particularly as we drive change on the issue of homelessness and addressing the fentanyl crisis. Thank you all very much.
Thank you, Mayor Gloria. We are fortunate having him. Our next Live Well leader and public health champion is Tamara Kohler. The applause will be louder in a moment when I tell you more about her. Tamara is a leader, and I was thinking about what kind of a leader. She's a leader with an indomitable spirit in helping people experiencing homelessness. She's a force for the public good of society's most vulnerable. As the executive director and the CEO of the Regional Task Force of the Homeless, she has single-handedly, and she won't take credit because she always gives credit to everybody else, but she really has been the force of that task force's growth, establishing the organization as a trusted leader and convener in the region, something we never had. And since assuming the role of CEO in November of 2018, Tamara has overseen the creation of a unique two-board structure to help ensure that homelessness is a rare, brief, and non-occurring, reoccurring issue for people. And that is a huge, audacious goal. She is adept at systems-level change and has a great knack for building strong relationships. She has a contagious smile, a warming smile when you meet her, right? Isn't it right? She makes you smile when you just see her. Because she has love in her and for others. And without a doubt, she has grown the task force's impact very strategically, very meaningfully. She has attracted top talent to her team, and very importantly, too, as a result of all these, increased funding for our region to address homelessness by $40 million annually, which has been a huge benefit to our region. Tamara has 19 years of senior leadership roles in homeless services, nonprofit, lending organizations, including spending over 8 years helping lead nationally noted homelessness reduction programs for the state of Utah. She has a strong track record in community engagement, contracting, and data-driven systems, critical today to really achieve measurable results and to ensure that the resources are sustained. It's one thing lifting it up, it's another than how you sustain it. And she's been able to do both. She joined the task force after having served in Seattle's Human Services Department as Division Director of Homeless Strategy and Investment, where she oversaw a nearly $60 million budget and the implementation of a new homeless strategy. Her awards are extensive, but I'll just give out that she received the Utah Housing Coalition Project of the Year honors in 2016 for a very innovative supportive housing toolkit. Much of all the great work she did in Utah, we transported here in San Diego. So we're very, very fortunate in that. As I said from the top of this, I had the privilege, having served on the Regional Task Force for the Homeless, with Tamara when she was the Chief Operating Officer, when she became our CEO. And what I saw and what I still appreciate is her deep sense of purpose and passion in partnership for performance of the public good, and has been an extraordinary collaborator and partner. And we are so lucky, not only those of us in this room, but the people who are unfortunate today of not having a home, having someone that's looking out for them in Tamara Kohler. Congratulations, Tamara. It was noted by the mayor that this next person doesn't slip in because her presence just is immediately known. Our district attorney's in the house, Summer Stephan, just so you know, and she's a huge champion helping our homeless as well, and thank you, District Attorney Summer Stephan. Well, our next awardee is not here. Like, what's up with that? What's up with that? You know, we had Senator Atkins, she's outside the country doing, great work and for us. Well, this next person is too. This next awardee is Dr. Hala Madanat from San Diego State University. And she's not here in person because she is proudly representing us all in Houston for the men's NCAA basketball championship. She literally, when she got announced this award, said, I could maybe, and this is about, 2 weeks ago, and says, well, if we go maybe to the playoffs and maybe to the next game, maybe I can, if we make it, maybe I could fly back. And I'm like, heck no, we need you there. But she is being recognized, not only for their amazing work, obviously, of this university, as the mayor pointed out, but I had the privilege of getting to know when Dr. Madinat was the powerhouse behind the university's Graduate School of Public Health when she served as its director. I have served at San Diego State Graduate School of Public Health for the last 26 years. I was there before she arrived, and I can tell you how much of a better place she has made it. She has moved since being the director of the school to an even more impressive role as the vice president for research and innovation at San Diego State University. She is the core investigator of the Institute for Behavioral and Community Health. She's a distinguished professor of health promotion and behavioral science, and currently leads the San Diego State UCSD Comprehensive Cancer Partnership, racing to find a cure for cancer. She's the evaluation lead of the San Diego Alzheimer's-related resource centers for minority aging research, and her research addresses health disparities through community-engaged research, and that is indeed her passion. And I can go on and on. Her diverse education provides really a unique lens that we're fortunate to have here in San Diego as it approaches public health. I've known her to be a leader who doesn't just have a can-do attitude. She goes beyond that. And it's pretty rare. We have some amazing faculty. You're going to hear one, a clinician, professor, all the way from Bayonne. You'll hear a moment. But it's rare when you find these clinicians, researchers, who go beyond what they need to do, but are always asking, go big for bigger impact. Like eliminating heart disease or eliminating health disparities. These are the type of people we are extraordinarily fortunate having. And Dr. Madinat deeply believes in the value of partnership. She's been an incredible partner to our county and our Health and Human Service Agency during the COVID pandemic. She co-led. I remember giving her a call and saying, we need to bolster up. We need to ramp up our disease investigation. Could you help us in developing a promotora model, a community-led model on contact tracing? Her immediate response was, absolutely. And she worked closely with Dr. Wooten and Dr. McDonald and our public health team, by the way. We have an extraordinary public health team. They're all here. I want to give them a recognition of our public health leadership team. They're right here. I just want to say immense thank you, Nikita, Cameron, and Dr. Hernandez, who you'll be here in a moment. Dr. Madinat's partnership with the agency goes far beyond the pandemic. She embraces the role. She embraced the role of an academic institution in partnership with our community. Her leadership has been crucial in development of a recently launched, we call it the Live Well Center for Innovation and Leadership, first of its kind, because no one else is doing Live Well San Diego like us here in San Diego. But this is a truly unique academic health and human services department in partnership with us here at the agency that's going to expand applied research, training, and workforce development in mental health and many other areas. So she's not here, but I know she'll feel our round of applause for her, and go Aztecs for today. Thank you. Okay, our next Live Well San Diego Leader and Public Health Champion Award is unique. How so? Well, this person, well, who's that? All right, this person, you're going to say, who's that? I know who that is. Some of you better know. You've read him, I'm sure, because this person often covers the scenes, the behind-the-scenes, events like this, and other important health news in our county. And that person is Paul Sisson, who is the reporter that covers the health of the San Diego County residents for the San Diego Union Tribune. Come up, Paul. And he does so masterfully. I should tell you, when we reached out to Paul, he's like, really, I'm getting this award? I usually roast you guys. You're giving me an award? Well, let me explain why. Last year, by the way, Paul was recognized as the San Diego Journalist of the Year by the local chapter of the San Diego Society of Professional Journalists. All his peers ranked him as the best. He was honored for distinguishing himself as the region's leading COVID-19 reporter and for keeping San Diegans informed during an unprecedented, ever-evolving crisis, and I couldn't agree more. Paul demonstrated true journalism leadership during COVID, and his colleagues took notice. He was not spewing misinformation. He was providing timely, accurate information. His questions to the county, and I suspect everyone else, were blunt, insightful, and sometimes a little uncomfortable, Paul, I gotta tell you. But his priority was clearly giving the community insight and news to smartly and safely live their lives in a time of great uncertainty. Early on, his bylined articles seemed a daily occurrence and usually on the front page of the UT. For a long stretch, the county was holding daily press conferences, and we heard from Paul, almost all of them. Doctors Wooten, Eric McDonald, and Kita Kadakia, myself, and so many others saw a lot of Paul during our time, during the 3 years of the pandemic. And I know for myself, I typically left our conversations confident in his understanding of what we discussed, despite being in a situation that was in daily, sometimes hourly, in flux. More than just covering the county government response in COVID, Paul went into, and this is a courageous feat, Paul went into the hospital wards in full PPE gear, and he did so in the darkest days. His resulting reporting and the newspaper photographs helped the community understand the toll the pandemic was taking on those impacted by the virus, and the doctors and the nurses, the medical specialists, and everyone else working around the clock to save lives. I am convinced it was articles that Paul Sisson did that definitely had convinced people to get tested and to get vaccinated and to protect themselves and their families. While his questions can be tough, as I mentioned, he was always civil and demonstrated a commitment to getting timely and accurate information to the public. Paul understands what his readers need to know and operates with integrity in getting them that information, and we truly appreciate him for that and all of his other incredible accomplishments over the many past years. Please join me in congratulating Paul Sisson. Doesn't matter, you got the award, he'll still roast us. So, but anyway, we love you, Paul. We love you, Paul. All right. Our last, but surely not least, of our 2023 Live Well San Diego leaders and public health champions is Matt Hoffman. Matt, please join me. Matt's the lead health reporter for KPBS. If you heard him talk, you'd know that voice. You know that voice for sure, right? And we know that's our San Diego's national public radio affiliate. Matt has also been, since 2022, the host of the KPBS Roundtable, which is probably the most influential community affairs program airing in our market. More recently, we are seeing more and more of Matt as an anchor on the KPBS nightly broadcast news. When you reach fate, don't forget us now when you get to that level, because he has. But let me tell you a little bit about Matt. He graduated from San Diego State with a bachelor's degree in communication. And while attending San Diego State, he became the general manager of the KCR College Radio, and a career was born. During his time leading KCR, the station was named Best College Station in the Nation by the Intercollegiate Broadcasting System. Matt also found time as a student to work as a part-time assistant in the KBS newsroom. And he's also worked at NBC San Diego as a writer and editor for the weekend morning shows. Over the years, I have worked with many journalists. Few of them come to an interview as prepared as Matt. He consistently goes out of his way to become something of a subject matter expert before you even sit down to talk with him. And that's greatly appreciated. His intentional, advanced work shows in his reporting. Whether you're reading his writing, listening on the radio, or seeing him report on television, there's an underlining sense that he's not just going from cue cards. It's a mastery of understanding what he's talking about. Matt reports with confidence of someone who knows his topics, as well as giving you the information most important to our lives. Another thing that sets Matt apart is his diversity of his Rolodex, or probably better said, his contact list. You can see that on display with the KPBS Roundtable and a variety of voices lending their expertise to the topic. I'm excited to see where he takes the show next, and I watch the show religiously. Matt's thoughtful dialogues during interviews are often not just about the news of the day, but looking ahead at trends, whether it be a pending expansion of mental health services or the impacts of an increase in public health spending. His reporting, like Paul's, is accurate, timely, and often forward-looking. Finally, Matt seems to always be out in the field, and I appreciate that. He and his video photographer seen together with a microphone in hand go where the action is, bringing the readers and listeners and viewers along for the fun and informative ride. Please join me in congratulating Matt Hoffman. Yes, come on in. Come on in.
Nick, get in here. Come on, Nick. Nicholas.
Who's covering the news if you're all here?
One, two, three.
Thank you.
Well, everyone, we are almost halfway through the award ceremony. So let's give another round of applause for all of the directors' awardees. I am excited and honored to recognize the San Diego LGBT Community Center as the Theme Public Health Champion awardee. I would like to invite Kara Desert and guests to join us here at the front. Just give them a round of applause as they make their way up. And I'd also like to ask Dr. Hernandez, Drs. Kaiser and Kadakia to come up as well. Yes. So established in 1972, the San Diego LGBT Community Center is the largest LGBTQ plus organization in San Diego County and one of the most vibrant and largest LGBTQ community centers in the nation. A multi-service organization deeply rooted in community, the center offers an array of direct services and community engagement programs. It is the only organization in San Diego County solely devoted to providing comprehensive and integrated services delivery and care to San Diego's LGBTQ plus community throughout their entire lifespan with the philosophy of no wrong door. The center has provided HIV services for nearly 40 years and over a 20-year history of providing administrative, quality management, and data support for HIV and STD services in San Diego. Starting with the provision of mental health services in the early 1990s, through the Ryan White Care Act, now known as the Ryan White Treatment Extension Act, then adding in HIV prevention and testing services in the late 1990s, they continue to this day to provide linkage and access to sexual health and HIV information and services. Most recently, as a key stakeholder and community leader in collaboration with the County of San Diego, during the monkeypox health emergency, the center took early steps to protect and educate the community, providing a safe space for people to come for emotional support. Once monkeypox vaccines were available, the center partnered with the County of San Diego Health and Human Services Agency and the Public Health Services Department to provide community-based sites for large-scale vaccination efforts, which resulted in nearly 1,400 vaccinated community members. Now, these are just a few examples of what the center does every day. They are committed to ensuring that every person feels and knows that they are welcomed, valued, and supported through its trauma-informed, client-centered, stigma-free, and judgment-free services guided by cultural humility. The center amplifies the LGBTQ+ community's voice with advocacy and collective power to ensure every person is safe, healthy, and thriving. Their advocacy work is grounded in addressing health, wellness, and human rights, and addresses social determinants of health such as environmental justice, worker justice, healthcare, access, fair housing, safe schools, immigrant rights, and hate crimes. The center's doors are open to all who are looking for a place where they can be their authentic self, get support, and connect with the community. For these reasons, I am pleased and honored to announce the center as the theme category recipient of the 2023 Live Well San Diego 22nd Annual Public Health Champion Award. Now I would like to welcome Dr. Ankita Kadakia, one of our two Deputy Public Health Officers, to introduce the next award recipient. Dr. Kadakia.
Thank you, Dr. Wooten. I have the honor to present the first of two individual Public Health Champion Awards. I would like to invite Dr. Anthony N. DeMaria to come up as I read your acknowledgement. Dr. DeMaria has dedicated his entire career to the prevention and treatment of cardiovascular disease. He served as chief of the Division of Cardiology at the University of California, San Diego from 1992 to 2004, and became the founding director of the Sulpizio Family Cardiovascular Center in San Diego in 2004. Dr. DeMaria is a diplomat of the American Board of Internal Medicine, a master in the American College of Cardiology, and a fellow of the American Heart Association, and holds many other professional certifications and memberships. As a professor of medicine at UCSD, he's trained many physicians who have gone on to distinguished careers in cardiology, and as an esteemed researcher, has over 700 publications in the area of cardiovascular science and serves on numerous editorial boards. Throughout his career, Dr. DeMaria has received over 50 honorary awards, including the American College of Cardiology Presidential Citation Award, California American College of Cardiology Lifetime Achievement Award, Association of Black Cardiologists Impact Award, and the California Department of Managed Care Right Care Initiative Leadership Award. He and his wife, Lori, have volunteered for many years in support of the American Heart Association's Go Red for Women campaign. Dr. DeMaria's leadership to make San Diego a heart attack and stroke-free zone has been an inspiration to clinicians, public health professionals, and community partners for over a decade. For these efforts, I am pleased to announce Dr. DeMaria as the individual category recipient of the 2023 Live Well San Diego 22nd Annual Public Health Champion Award. And now, And now I'd like to ask Dr. Cameron Kaiser, Deputy Public Health Officer, to present the second individual award recipient.
Dr. Moore, a nice try. You have to get a photo. I'm sorry. Good try. He never wants any recognition, but you got to get one here.
Sorry about that.
Good try. Here in the middle. Just take that.
Thank you, Dr. Kadakia. The second individual category award goes to a person who displays exemplary leadership, compassion, and understanding in the arena of mental health. I would like to invite Catherine Nicario, along with her guest, to come up and join us. Catherine has more than 40 years of experience demonstrating achievements in protecting and promoting the health of the San Diego County population. As Chief Executive Officer of the National Alliance on Mental Illness San Diego, one of the largest affiliates of the National Alliance on Mental Illness Network, Catherine serves as the primary public face of NAMI San Diego, enhancing the credibility, visibility, brand recognition of the organization by utilizing her professional experience in health and wellness to increase resources available to meet community mental health needs. As a recognized thought leader and forceful advocate in the local and national movement helping people who live with mental health disorders, she is a frequent source for media stories around issues of mental health, mental illness, and homelessness. In November 2021 and 2022, Catherine was listed as one of the San Diego Business Journal's 500 most influential business leaders in San Diego. She was also honored in March 2008 by Biz San Diego magazine as a woman to watch in the San Diego community. Thank you for your contributions to public health in our community. You truly embody the vision of Live Well San Diego, and it is with great honor to announce Catherine Nicario as the individual category recipient of the 2023 Live Well San Diego 22nd National Public Health Award.
Take your tags off so you can get the shit.
And now I'd like to ask Dr. Hernandez, Public Health Services Director, to present the Organization Category Award.
Thank you, Dr. Kaiser. I am honored to present this organization for this year's Public Health Champion Award. I would like to invite Hector Paredes and Rina Paredes Grison to join us, please. Given its namesake, the Eric Paredes Save a Life Foundation honors him through their commitment to prevent sudden cardiac arrest in youth from happening to other families. Like Eric, 23,000 lives are lost annually to something that could have been prevented. More than a decade, the Eric Paredes Save a Life Foundation's free prevention programs help parents, students, educators, teams, and medical professionals understand the incidents of sudden cardiac arrest and what needs to be done to avert this needless loss of life. At these events, actually one is happening April 23rd in Santee, so please check out the website for that. Physicians, middle and high school colleges, hospitals, health districts, teams, educators, parents, and students work together to find the 1 in 300 at risk and empower participants to be prepared to respond to a cardiac emergency. While the Eric Paredes Save a Life Foundation is the only San Diego organization dedicated to comprehensive sudden cardiac arrest prevention in youth, It is also a part of a national movement to protect young hearts through awareness, education, and action. Their local impact has helped drive the national dialogue in youth health and well-being through improved sudden cardiac arrest prevention policies and practices. The San Diego community benefits from a forward-thinking service model not yet offered universally, which simultaneously helps advance the standardization of sudden cardiac arrest prevention throughout the state and the nation. Through this process, I had the opportunity to visit their website, learn more about this great foundation, and see their very powerful video honoring their son, Eric, and the wonderful work they do. And so, for all of these efforts mentioned, I am honored to announce the Eric Paredes Save a Life Foundation as the 2023 Live Well San Diego 22nd Annual Public Health Champion Organization Award recipient. Congratulations. And now I would like to ask Kimberly Gallo, Aging and Independent Services Director, to present the HHSA AIS Public Health Champion Award. Kimberly.
Thank you so much, Dr. Hernandez. I'm excited and honored to recognize Ms. Carrie McClellan as our Aging and Independent Services Public Health Champion. I would like to invite Carrie to the podium to accept this award and any of her guests that are with her. So come on up. I should also thank Public Health for using large font because I forgot my glasses today. So this is very age-friendly to have this large font to read from. So thank you. But I want to start with, for more than 14 years, Carrie McClellan has been a passionate contributor in the field of aging and senior care, first serving as the Social Services Director for a long-term care skilled nursing facility. Then in 2011, she joined the team at Elder Help, a local nonprofit committing to helping older adults live independently in their own homes. As the outreach manager for Elder Help, Carrie works tirelessly to serve the senior population. Carrie cultivates trusting relationships with senior service providers, educates and supports family caregivers, and finds and trains community volunteers. In addition, Carrie furthers community awareness of elder health programs, including the Home Share program, a roommate matching service that connects individuals who want to share their home with others who are seeking affordable alternative housing options. Carrie has played a significant role in a new collaboration between Elder Help and Alzheimer's San Diego. Through this partnership, older adults who are living alone, losing their memory, or showing signs of dementia are supported to continue to live safely in their own homes by receiving grocery shopping, transportation, and home security services. Carrie is spearheading this partnership training effort, working alongside staff at Alzheimer's San Diego to instruct both current Elder Help volunteers and potential volunteers. Carrie contributes to and supports many of Aging and Independent Services programs and initiatives. She serves on the Age Well Health and Community Support Team, offering her expertise on older adult issues to help advance Age Well goals throughout our county. Additionally, Carrie is an active contributor to the Caregiver Coalition and has been part of the Speakers Bureau, conference planning, and educational committees within the coalition for many years. Carrie is a leader who never hesitates to step up to the plate. In the absence of a facilitator for the San Diego and East County Community Action Network, known as Sandy ECAN, in 2022, due to transitions with the AIF staff, Carrie volunteered to facilitate the group and continues to be the interim facilitator. Carrie and her staff make it a priority to be involved with essential AIS events, trainings, and activities, including the recent Aging 101 training for for Homeless Services Providers, and the Awareness Prevention Fraud Prevention Conference and Resource Fair. Throughout these and many other activities that Carrie is involved with, she has positively impacted the lives of thousands of older adults in San Diego. But perhaps one of her most important contributions is the attitude of profound respect that Carrie brings to her interactions with our senior populations. Carrie thinks of every senior as a leader and strives to treat every older adult with the utmost care, dignity, and respect. She sets an example for how staff and volunteers within Elder Help approach their clients and ensures that all community members are met with compassion and support. For her many accomplishments and ongoing commitment to older adults, I'm proud to present Carrie McClellan with the Aging and Independent Services 2023 Live Well San Diego's 22nd Annual Public Health Champion Award. And now I would like to ask Jennifer Bransford-Coons, Office of Equitable Community Directors, to come up to present the next award.
Thank you, Kim. So I am extremely happy to be here today to honor and celebrate several individuals and organizations that have dedicated their efforts to making each of their regions healthy, safe, and thriving communities. I'll be presenting the Regional Public Health Champions Award today. These 6 awardees stood out as exceptional organizations and individuals who are working towards a more equitable San Diego County. As mentioned earlier, the theme of this year's National Public Health Week is centering and celebrating cultures in health, and all 6 regional awardees do just that. They make it their mission to celebrate individual cultures and strive for equity, diversion, and inclusion. This is why we chose them and why we honor them today. So I'm going to start with South Region. So I would like to begin recognizing the amazing organizations and individuals, and I'd like to introduce Episcopal Community Services, or ECS, located in South Region. Let's welcome up Leslie Manriquez for the Para las Familias Program Manager, and her guests to come up here to be recognized. ECS began with social welfare services in 1927 and then expanded its programs in 1954 to address the physical, emotional, and spiritual needs of all San Diegans. Today, we are honored to award Para las Familias as San Diego Region Public Health Champion. PLF is an outpatient behavioral health and mental health clinic serving families in the South Region of San Diego County. The program provides outpatient bicultural and bilingual therapy services, such as behavioral screenings, family and group therapy, teacher and provider consultation, and school observation, and parenting groups for low-income children and their families. More recently, PLF expanded its health services to provide access to children ages 0 to 12 years old, improving accessibility of behavioral health and mental health services that have a positive impact on the bond between children and their families. Thank you so much for your work. Moving into the Central Region, I'd like to congratulate Trans Family Support Services. In early 2015, Kathy Moling founded Trans Family Support Services, or TFSS, a nonprofit organization in San Diego serving transgender and gender nonconforming youth and their family. I'd like to welcome Kathy Moling to come up on stage and bring, oh, already here. So, as a parent advocate, her transgender son, Kathy, helped navigate his journey. As a result of their family's ongoing experience, the need to help others became more and more apparent, which led to the creation of Trans Family Support Services. Their vision, a world where all genders are accepted and treated equally. Trans Family Support Services saves lives by fostering a supportive and inclusive hub of resources for all trans individuals, families of trans youth, and overall LGBTQ+ community. Services and resources include events that support navigating gender transition, family engagement sessions, training and education, and support groups. They also offer free insurance assistance for trans youth and trans adults to complete the insurance pre-authorization and appeals process. Thank you so much for the work that you and Trans Family Services do. Moving on to the North County, the North Inland awardee has greatly impacted the lives of many Fallbrook families. I'd like to welcome up Graciela Moreno to the stage, and anybody that may have come with her to accept the award. Graciela Moreno of Palomar Family Counseling Services, or PFCS, who supports grandparents raising grandchildren and kinship families, is more than a case manager. Not only does she support her families by finding support and resources, but she also hosts events focusing on bettering the health and wellness of these caregivers, many of whom are Hispanic or Latino. She coordinates events ranging from self-care workshops that include activities like chair yoga, positive affirmations, and blood pressure screenings, to educational legal workshops. Graciela is known in the community for going above and beyond for her kinship families. Thank you for all that you do, Graciela. Up next, for our North Coastal awardee, we would like to congratulate Dr. Beatriz Villarreal and her family, or can come on up. Dr. Villarreal was the director of Mano a Mano Foundation, a nonprofit dedicated to providing support and education to the Latino community. I've already welcomed you to the stage, but welcome again. Dr. Villarreal has dedicated over 25 years of experience working on prevention through her foundation, Mano a Mano. Dr. Villarreal provides community and family education in a dynamic and impactful way. Her main objective is to help young people succeed in life through great great and effective family communication, a method that helps them with self-esteem and prevention and education about the damaging impact of drug use. Her mission is to provide the Latino community with a helping hand through education, not only in San Diego, but also throughout Latin America. She is dedicated to helping young people commit to their future, giving their families the necessary tools to teach values, traditions, and discipline as a foundation for their children. Congratulations. So next, on to our North Central awardee. I'd like to congratulate Rose Cabellos from Bayside Community Center. Could Rose come forward? I saw her earlier. There we go. Rose has been with Bayside for over 45 years. She started in the womb, which is literally half of Bayside's 90-plus years of existence. During that time, she served as Director of Social Services, Deputy Director, Project Manager, Information and Resource Coordinator, Director of Social Services, and is currently the Director of Programs and Operations. Rose is the backbone of this organization and the Linda Vista community. She has decades of experience engaging residents across generations, through which she has earned the community's trust and love. Rose has connected with community members in so many ways, providing a helping hand to all who need it. We are proud to celebrate Rose Cabellos as the North Central Regional Public Health Champion. Last but not least is our East Region awardee, who's not here with us today because she's celebrating her award by having a fabulous vacation in Mexico. But we'd like to congratulate Mrs. Joyce Moore, a devoted community organizer who loves working for her community of Lemon Grove. She is a youth advocate and an inspirational speaker dedicated to advocating for policy changes to improve public health and safety. Joyce has worked to bring healthy foods to the Lemon Grove community through her tireless coordination of Lemon Grove Farmers Market and the Community Garden. She also leads the Lemon Grove Community Collaborative, and this year organized Lemon Grove's A Black History Celebration, bringing food, fun, and art to the Lemon Grove community in a celebration of Black History Month. Joyce is a shining example of this year's award theme. We are incredibly proud to honor this year's public health champions. Thank you all very, very much. And now I'd like to invite Dr. Hernandez back up for some closing remarks.
Thank you, Jennifer, and congratulations again to everyone who received awards today. As we close our award ceremony today, I would like to personally thank all of the staff and community partners who worked together to make this event possible. In fact, for those who had a hand in creating this event today, please stand so we can recognize you. Don't be shy. Please stand. We appreciate all of your hard work. Thank you. We also want to recognize some of our key leadership here at the County of San Diego Health and Human Services Agency, Dr. Eric McDonald, Kara Ricketts-Helly, Anita Walia, Courtney McDonald, Adrian Yancey, our Assistant Director of Public Health Services, and Tim McLean. Thank you all for being here as well. Thank you. Now, this is a special recognition. Our event coordinators, we could not do this without them. Mike Jones and Martha Guzman, please stand and raise your hand. There's Mike there. Is Martha here? She might be next door getting the reception ready, but when you see her, please thank her for the great work. Thank you again. They are our planning committee members and event coordinators here. And to all the planning committee members who played a pivotal role in presenting this Memorial Day event today. To the awardees, congratulations again. Your unwavering commitment to health makes a difference to our local community. I think we're all inspired to continue to celebrate the power of cultural humility and prevention, advocate for healthy and fair policies, share strategies for increasing equity, and champion the role of a strong public health system. We realize we can't achieve optimal health and wellness for San Diego residents alone, and that our greatest asset is the partnerships between people and organizations across various sectors in the county and in county government. By coming together and learning from our cultural differences, we can use our collective power and knowledge to make the greatest positive impact. Again, thank you again for being a part of today's event. For everyone, please join us for a reception in honor of the awardees just across the hall in room 302. And we look forward to seeing you all and celebrating again in 2024. Thank you.